So very good morning, everybody.
Morning.
So let's all begin with a lovely smile over your faces, first of all. Yeah. So this is the very first event, the kickstart event of Ed's Group Education Team, starting with the event called Smile-a-thon. It's a dental or oral hygiene awareness campaign and one-to-one consultation session done by our expert guest, Dr. Ali Asgar of Dana Medical Polyclinic above Dubai. And so we welcome all of you to the event, first of all. And before we go on to his presentation, we would like to thank our management, especially Mr. Shahin and Shekhar, for doing such an initiative of bringing the importance or highlighting the importance of sharing knowledge, experience and skills among our fellow members, our fellow colleagues, and which helps our company as a whole to perform in a better way. So let's move on to the presentation part from Dr. Ali, and then we'll, as per the schedule, we'll be moving on to the conference room for the one-to-one consultation as well. So Ali,
thank you
to the stage.
Thank you.
Please.
Thank you everyone for coming. Thank you. Okay. How many of you have last visited a dentist? When was the last visit? Anyone would like to answer this question? When was your last visit?
Last year.
Last year? A star for you. Anyone else? Last year. Okay. Last month. Okay. Anybody over here who has not visited a dentist in at least more than that? Anybody? It's okay. You don't have to be shy. It's fine. Some people.
I think I have visited more than one.
Okay. That's good. I appreciate the honesty, everyone. I appreciate the honesty. So, look, first of all, this profession, right? It's like an art. So you might be understanding that a lot of people, you go to one dentist, you go to another dentist. One dentist tells you that, do this particular thing. Then the other dentist says, no, that, don't do that, do this. The reason is that this profession is like, everybody has their own artistic skill in it. And one person might be very confident with that skill and he'll be able to bring out the best in you through his skill. So that's the reason why we have such differences in the profession. But the reason I wanted to start with honesty is because honesty is the only way we can make this profession feel more welcoming and approachable. So I wanted to actually, my goal here was to show you guys the consultation. I mean, you've already been to a consultation before, you've already seen what it looks like. But I just wanted to show you a different experience this time, and I wanted to bring it to you instead of you having to come to an official dental clinic and feel all that phobia. You're very comfortable in your own offices, so I think then we can have a more open communication about your dental health. So that was the idea. Now this presentation over here is a small one. It's just nothing too, no real base scary images or anything like that. Just a simple idea on what dental sensitivity is. How many over here have dental sensitivity? Any sensitivity issues when you're having cold foods, hot foods? Do you feel like that shock? You feel that? You feel it? Is it really like painful, or is it very just mild, or?
Painful, like hot things.
Okay.
Yeah.
It becomes painful. And how long does it last? Does it stay for the whole day, or does it just go in like 5 minutes or maybe 1 second? Few minutes. Anybody else over here suffering from dental sensitivity? It's okay. It's not. If you're shy, it's fine. I will talk to you later. It's no problem. So, dental sensitivity is a very common problem. Many people have it. Okay, and I'm just going to share a few things about dental sensitivity and how you can actually fix it yourself. Because also as a dentist, I prefer if you don't come to me. As much as I do wish that you would come to me. So it's two ways. Okay. So the first thing is that when does it occur, right? Number one, hot foods, cold foods, chewing, and sometimes it just happens throughout the day. Those are the 4 ways sensitivity can happen. Okay, sensitivity is also pain. It's the same thing. Okay. So I have sensitive teeth, but how do I fix it? Right? How do I fix it by myself at home? Because a lot of people say, okay, I have dental pain, doctor, which toothpaste should I use? Which brush should I use? I said, but you already have tooth pain. So why don't you just come to the dentist? But I cannot do that. So I would say that if you are looking for a small helpful remedy, you can try these few tips. Okay. So what is the reason for tooth sensitivity? Sorry, these are only the images that are going to be disgusting. After that, it's all going to be better from here. This is a cavity can cause sensitivity. Normally a sensitivity from a cavity will be like a very sharp pain that only lasts maybe a few seconds, even a millisecond at the time of biting. That's when the cavity pain starts, like that. And then you can have so gums, sometimes you can tend to brush a little harder, and I'll show it to you when we have the consultation. If we brush it too hard, we can damage our own teeth and we can damage our gums. So that's what happens when we damage our teeth. Our gums start to go down and it exposes most of the tooth to the air, and that's when you start to feel sensitivity with cold, ice cream, things like that. And then you can have a very old filling, and remember these fillings back in the day, 20, 25 years, most of us probably don't even have those fillings. Some people maybe have those fillings, right? So these are amalgam fillings, silver fillings, right? And they tend to get a little bit old after 10, 20 years, and they need to be replaced. 15 years is an average, replacement lifespan for these fillings. Now, some people say, what toothpaste should I use? Guys, the main thing that you should see in a toothpaste is the word sensitive. If you have sensitivity, default to this kind of toothpaste. Any brand creates sensitive. I showed Colgate there, but I'm not endorsing or anything like that. You can go to any brand which says sensitive. I prefer Sensodyne Rapid Fast. That works really well. It's a very quick acting one. You can apply it like a cream on those two teeth that are affected. And another tip is, when you're brushing, a quick show of hands. Who rinses their mouth immediately after brushing with water? After you brush, who rinses their mouth after brushing? Everybody, mostly? Most of you, right? No. So some of you, you are, okay, so what do you do exactly?
Rinse it.
You don't rinse it. So what do? You just leave it in, you leave it in, right? So the excess foam, you probably let that out and then you just leave some of the paste on your teeth. Ideally, that's the best way to do it. Leave some of the foam in your teeth. That's it. It's disgusting, I know. We go for breakfast right after. The mint taste is not very, very, very satisfying. But if we get used to it after that, and the advantages of leaving the toothpaste around our teeth, they are huge. We can actually save a lot of the sensitivity that we have from just doing that. So if you currently have sensitivity, this is the best way to do it. Just leave the foam inside after brushing. One more thing in that slide is, remember that this does not fix the issue. If you do have sensitivity, don't expect your toothpaste to fix the problem. It will not. It is only a temporary solution. You still have to come to the dentist after, if it's still there. Okay, next. So whether should I change my toothbrush or not? I showed Chloroprox is a very nice brand. I use it personally. And who all uses soft toothbrush? Raise of hands. Only one person? Okay. Soft. Medium, who's medium? Team medium. Team medium? Okay. Everyone's using medium, yeah, okay. What about team hard? Anybody? You're using hard toothbrush? Okay, so see, the problem with the latter half is that, it can actually damage your teeth a lot, and it will do it very quickly. It's like, rubbing two stones against each other. It will really create a lot of damage to your teeth. So we don't want to use hard at all. And I would prefer not even using medium. If you guys are using medium, switch immediately, because that will create a lot of problems in 5-6 years. Okay, so we would like to go to soft, and if you have the opportunity to find ultra soft, all of you switch to ultra soft. Okay, I'll teach you how to use the brush. I know you guys think maybe soft will not last as long, but I can use soft for 3 months and it'll still look the same, and I'll show you how to do it. Okay, ideally you should change your toothbrush in 2 months, 3 months only. Okay, this is something called Bass technique. I'll show it to you in how to do it over there. And the light dip, and I'll show you how to do it as well. Who holds their brush like this? Fist. Anybody? Fist? Right? We all hold the brush by fist. Yeah, we all do it, right? Who holds the brush like this?
Yeah, like this.
You, Rakesh, you do it? Yeah, okay. Rakesh is the gentleman who holds his brush very lightly. Okay. Ideally,
I want to see now.
like a peacock. So yeah, I guess you can remember it now. We ideally should hold the brush like a paintbrush, not a peacock paintbrush. Okay, so we ideally hold it like this, not like this. And the reason we hold it like this is because we are training ourselves subconsciously early in the morning. We can't remember a lot of things. We don't want to think about brushing. So what we do is we just hold it like this and then let the muscle memory take over. When we hold it like this, we apply a lot of force on our teeth automatically and we don't realize it. But when we hold it like this, we're unable to apply force. So if this is a toothbrush and I hold it like this, you see that? I'm able to really apply force against the finger. But when I hold it like this, you see how there's no force anymore? That's the only amount of force you need to clean your teeth. That's it. Your brush just has to touch the surface. It does not need to scrub. Brushing is not for scrubbing, okay? That's the idea. So I just wanted to talk to you a little bit about Aldana. I work in Aldana, okay? Dana Medical Polyclinic's been here in UAE, Dubai, opposite Royal Ascot Hotel, which is, Aster Pharmacy or Aster Clinics in Dubai, Mankul, just ahead of it. We are on the main road and we've been there for 27 years. Okay, so we have 5 specialists over there. We have a crown bridge specialist. We make veneers. We're a veneer clinic. And yeah, if you ever wish to drop by, do message me. I'll be giving you my card and everything after this.
You'll be giving you some discounts.
Yeah, I will, definitely. Don't worry.
Okay, any questions that you would like to ask the doctor?
Yeah, I would appreciate it.
Genuine questions.
Yeah.
So, would you want to how do you know the brush is done?
How do you know the brush is done?
Yeah, meaning
Yeah.
time to change.
Yeah. So,
Change or what?
Shaheen here has a question, okay, about how do you know if the brush is worn out, right? Your brush should never wear out. Okay.
Mine goes back.
So you're holding it like a peacock, right? Next time hold it like a paintbrush. It will not happen. Okay, see, ideally do not let your brush fray. If it frays, that means that's a sign that's either too old, maybe we're talking about 7-8 months old. Okay, but even if it's fraying in a month, then you need to reassess how much force you're applying, right? You do not want to use the brush like it's a proper cleaning item. It's not a scrubbing tool. It's just to touch the teeth. It's to massage the gums. That's it. That's how we're doing it, right? Yeah.
Normal brush and the electric brush, which one do we prefer?
So I will be able to tell you when I see your case. Like if I see your brushing habits, I can tell you which is better for you. I cannot just say that okay, electric is always the best. Okay, I personally use manual because I know the best technique for myself. But if I feel like you don't have the convenience, you don't want that sort of hard work, you can always switch to electric. Electric will do the job for you. So it's like that. But then you can also create more damage with electric. So I need to see how you're brushing. That's it. Yeah.
How often do you have to shave the brush?
In 2 to 3 months. 2 to 3 months. Yeah. Some people will say 1 month. Good for you if you like to change your brush once a month. If you buy Chloroprox, it's a little expensive. So it depends on your how you like to change the brush. But I would prefer to change it every 2 to 3 months. That would be better.
So if only soft was good, why is there medium and hard brushes?
So see, first of all, medium and hard brushes are not for your general dental use. It can be used for other applications, but they always make it. They have to make it because of demand. So it is not that the dentists will always recommend it, but they'll still make it because it can be used in other applications. Sometimes even dentures need to be cleaned though. So you have those plastic teeth that come out for old people. Old people wear dentures. So when you remove them, you need to brush them too. But you can't use soft. You can't use medium. You have to use kind of harder brushes there. That's why they, yeah.
Okay guys, any more questions?
Ideally, how many days? How many times in a day you can ideally for brush?
It's a good question. It's a good question. I'll tell you a very, very cool, very interesting fact. I'll tell you a very interesting fact. It actually in some books it says 3 times a day. Yeah, it's strange, isn't it? You've heard of it. So, but the problem is that we apply a lot of force, and sometimes some people it's enough is just twice. You can't do more than that. Okay, I'll ask a better question. Will be better for you. Okay, you answer it for me. Okay, okay, fine. Somebody else, no problem. Whoever knows. Which time is best to brush? Morning or evening? Why in the evening? Can anyone answer?
After that, we are going to sleep. So
Okay.
no activity inside the mouth.
Correct. Rakesh, are you a dental student? Okay. Correct. Actually, it is a perfect answer. There is no movement in the mouth, right? So the tongue is not distributing the saliva, and the antibacterial effect is not there in the mouth when you're sleeping. So if you eat and you sleep without brushing, you tend to create a lot of damage. Now, a lot of people, when you're fasting, some people before suhoor, after suhoor, you guys tend to, hi, how are you, good? Yeah. So you tend to brush before or after suhoor, right? So there is this thing about, there's this question generally asked. And what I tell is, see, first of all, if you're going to brush after suhoor and you're taking early suhoor, let's say you're having suhoor 1 hour, 2 hours before suhoor ends, then you can brush after, that's better. I would always prefer to keep a 15-minute window after you finish eating. Do not brush right after you finish eating, whenever, at any situation. Because right after you eat, there's this acid build-up in your mouth. You can't feel it, obviously, but there's bacteria that's constantly breaking down the food and breaks down in seconds. So the pH actually in the mouth, the acidity in the mouth rises very quickly, and we don't know that. We are used to it. But the brushing right after the food will cause more damage to the enamel than if you were to not brush at all. So you see how we are actually not able to maintain that way. So that's.
So following up on others' question.
Yes.
So if you actually brush in the night,
Yeah.
you actually have to brush in the morning.
Yeah. Well, you are the answer to that. I don't have to tell you. Yes. Well, the reason.
Don't come to office.
Yeah. Yeah, there's a lot of bacterial load in the morning, and bacterial buildup is still going to be there. So you have to kind of remove it before you.
Okay.
Yeah.
I guess Shekhar is going to ask any questions.
Yes.
He knows all the dental questions. Okay, guys. I think because we are out of time now, we wind up this session here. Just to add on to how much Dr. Ali is putting his effort today. So when I called him, actually this was scheduled for tomorrow on Saturday, and he's traveling tonight. Okay, and in this tight schedule, he said, "Let me just come and help you guys out." Okay, so he's traveling tonight. He came today after morning session, leaving everything away, and now he's going to do this one-to-one check for you guys. So thanks a lot.
Thank you.
So on behalf of the Edge Education team, we would like to thank Ali for the wonderful presentation he has presented in front of us. So and wonderfully have replied to all the queries that we had. So now let's move to the one-to-one
Yes.
as early as possible.
Yes, that's possible. Thank you. Thank you. Thank you.
So